Aloha, everybody. Apologies for being a little late. I had to change a diaper. Um, Let me just get everything pulled up and we'll get going. Okay. Oops. It's our fabulous five. Aloha Lee, Debashish, Janet, Jim, and Kiyoshi. Yosh, thanks for joining us. Hopefully we'll get a few more online. I was not expecting to pop on, but I'm glad I was able to sneak away for a little bit today. It's going to be one of our shorter meetings. I think either next week or the week after, we'll have an update on the genetic sequencing by Marguerite's team. I think they're close to being done. So we'll see an update on that. So once again, keeping an eye on Japan. Unfortunately, their increasing trend continues. And as we near the summer months and as tourism continues to tick up, and Oahu is staying in tier 3. We just wanted to keep an eye on, even though our hospitalizations are not going crazy yet. This is just another thing we want to keep in mind, especially with our current reopening strategies. At a national level, you can see that we have plateaued, which is good that we're not increasing, but concerning because earlier this week, CDC now announced that the UK strain is the predominant strain in the United States, and studies have confirmed that it is more infectious than the previous strains that have made its way through our country. The positive news is that our vaccine efforts are seemingly keeping up to a certain degree and really keeping down the fatalities and hospitalizations. But of concern is that now our younger demographics are being hit a little harder than historically with the new variants. Arizona and California remain relatively flat, which is good news. And then Nevada and Texas are also at a similar plateau. However, we do know that there is a lag with any type of major cluster or surge event. And Texas, I've seen some news that they have pretty much opened up, Texas Stadium, their baseball team, having, over 30,000 attendees for each game and minimal mask wearing. So, remains to be seen how some of these states with looser regulations will fare with the spread of the variants, with the UK variant and the South African variant becoming more prevalent in our country. Looking at our Hawaii specific overview, Maui, unfortunately, is a little over 15 cases per 100,000, and the percent positivity is over 3%, a large part due to that cluster last weekend at the church, and hopefully we'll bring that down. Our percent positivity for the other counties and for the state as a whole continue to increase slightly, and especially as we reopen, and I'll speak to what's going on in Oahu in a little bit. Our vaccination efforts continue to improve across the state. 84% of vaccines that we have received have been administered, which is amazing, and just a testament to the great collaboration of work. So, in terms of getting shots in arms, we were doing really well, and I believe we are close to opening up to age of 16 and over for vaccine status. Once again, no major updates to testing turnaround time, continues to be relatively constant and stable. Oh, sorry, my secondary screen is not cooperating. Our Hawaii forecast, a slight uptick in our cases, and then you'll see a corresponding increase in our hospitalizations and ICU, minimal in fatalities. It's really hard. I think we're trying to strike the right balance with vaccine efforts and current strategies for reopening, and I think that's something we're seeing across the nation. with our CDC ensembles and some of the other models. It's just figuring out the right balance between how effective we are with our current vaccination efforts, with loosening of restrictions and the impact of the variants. Is just, it's going to vary by state, and by county as well. So we will continue to watch this. But the good news is that we're not expecting any major spike in the next couple weeks. No major, this is just what you saw on the previous slide. So three major science highlights, and I apologize for not being as up to the news this week. I've been pretty sleep deprived since Monday evening, but I was able to catch one big update from the CDC earlier this week, and then some major news items, and then one research related update for our science highlights. So CDC has updated guidance regarding COVID and fomite or surface transmissions. So relatively very low risk of fomite transmission, less than 1 in 10,000. And so what that will do is, hopefully people's behavior will continue to be vigilant, but this shows that we can start to adjust our policies and mitigation efforts to really continue to target it towards face-to-face transmission, and aerosolized and droplet spread. I do, it's kind of funny to look back, but when we're in the midst of it in April and May, people were wiping down their groceries with Clorox, and we know that now, that's not necessary. From a national level perspective, our President Biden moves up the COVID-19 vaccine eligibility date to April 19th, which is 2 weeks earlier than the May 1st deadline that was set earlier this year. The previous goal was 100 million shots in 100 days, and we are, as a nation, set to greatly outpace our vaccination efforts that or levels that the president had set previously earlier this year. On a note of concern, nothing crazy yet. However, this is for Hawaii, Oahu County specifically. The Mayor Blangy already got approval from the governor to continue with Tier 3 operations for, I believe, 4 weeks, even though some of the the metrics would have started the clock to bring us back to Tier 2. I screenshotted this and I just added this in a few minutes prior, because it is important. I think what the mayor is saying is true, that it is up to the community to keep case counts low. However, what I've been hearing and seeing on message boards, et cetera, is, once again, there's always, the mixed messaging and, different groups of populations thinking it's due to tourists and not really due to, the locals, and just continue to, we need to, as experts and concerned citizens, need to continue to message that it's everybody's responsibility to be safe, to continue our mitigation efforts until we reach the point where our vaccine levels have reached a threshold where we're not as concerned about a major spike. And then finally, one more science update. We have a publication in New England Journal of Medicine looking at the efficacy of the AstraZeneca vaccine against the South African variant. And basically, even though the sample size is relatively small, the conclusion is that the 2-dose regimen did not show protection against mild to moderate COVID vaccine against the South African variant, which is not surprising. What we've seen about efficacy against the variants is a relatively low efficacy against just any type of mild to moderate. But what we're really paying attention to is the severe and hospitalization cases. And so what we've seen so far is it still does a relatively good job against keeping people out of the hospital and out of the ICU, which is at its core what we're trying to do. And that has it for our science highlights and our data updates for this week. I do have a question from Jim. In terms of input that HiPAM had in the mayor-governor decision, we unfortunately were not consulted in this decision. Once again, there are a lot of forces at play that went into this decision, and as the situation evolved from April to last April to now, I think the who makes the decisions and who's at which organizations are involved at different steps have shifted, both with the changes in in policymakers and decision makers as they have switched out, and as the battle rhythm and the operation tempo has adjusted and the mindset has shifted. So unfortunately, HiPAM was not consulted, Jim, but I think it's clear that the focus of the current administration for the city and county of Honolulu is to really focus on opening up the economy. And that's not to say that's not a bad thing. I think it just needs to, the right emphasis needs to be put on a community effort. And it's, the sound bites are great, but it's once again, the day-to-day efforts and the correct messaging and the community outreach to both the residents and the tourists, and all the workers involved to really make sure we do a good job, and to not let social media positively or negatively impact how we protect our community from future transmission. No, you're not putting me on the spot, Jim. And unfortunately, as much as we have tried to put HiPAM in touch with those who are closer to decision makers, there's only so much that we can do. And we have gained a lot more traction in terms of our work and our messaging. It's just there will always be forces at play that kind of have priority, and that's going to be pending who sits in the decision maker's seat. So there's only a limit to what HiPAM and other other organizations like COVID POW and everybody who has our community's best interest in mind. Is just a differing of perspectives and priorities, and our goal is just to make sure that the science and the medicine is present in the decision-making room, and that's the best we can do. But thank you for asking that. Any other questions, comments, concerns for this week? And I apologize, I might not be able to answer all of them. Once again, I'm running on fumes, and that's putting it positively, but always here to support any questions. So I'm sure from the core group here, you guys are already on top of a lot of the updates anyway. Marguerite, I saw you joined us, and Corey. Marguerite, I need to respond to Ethan, but I think we're ready for a pretty substantial update from your team. So I'll get back to him. I will hope to have you guys either on next week or the week after. The meaning of life, I think right now the meaning of life is to make sure my baby is not crying throughout the night. That's my biased perspective of the meaning of life right now. Oh, awesome. Thanks, Marguerite. So Ethan and Claire, I apologize. I've been just a little busy, but next week or the week after, whatever works best for you, we'll love to have you guys on and to present your findings. Yes, the answer is life and balance. I apologize. I'm just happy to be here and to interact with you guys, but I'm sorry I don't have much more to add this week. Hopefully, as I adjust to the new schedule, I'll be able to spend a little more time catching up on science updates. Janet, anything, any major updates to add from your foxhole and from Kauai? I know you guys had some changes to your policies for travel, but I'm not sure if
Yes.
there, oh, hey, how are you, Janet?
Hi, we're back in safe travels fully as of Monday, so it's much too early to know whether, to see cases related to that, although we certainly expect that we will. Our daily arrivals have gone from about 500 to about 3,000.
Wow.
We do have voluntary post-arrival or voluntary 3-day post-arrival testing that the travel industry has been very supportive of, is offering lots of incentives to people to take advantage of that. So we're hopeful that that will help us catch some travel related cases. We do still have a number of cases in a single household related to inter-island travel, and we are doing genomic sequencing on that group of cases. I expect that we'll have results maybe about this time next week, maybe earlier in the week, but some concern that, of course, about variants, and we hadn't had a case for a while, so this was a
Yeah.
good group to test.
Hmm.
And we've also this week we opened vaccinations to everybody 16 and older. So we're continuing to vaccinate and to encourage people to come and be vaccinated. With increasing availability, it's not difficult to get an appointment anymore, so that's encouraging. And we've vaccinated 40% of our population has received at least one vaccine, and close to 30% are fully vaccinated.
That's awesome. That's really great news. Thanks for all of those updates. One
Yeah,
question, for the voluntary post 3-day test, is
yeah.
that an antigen test or is that a PCR test?
It's an antigen test, and well, it can be whatever.
Okay.
But the most readily available and affordable options are antigen testing and then confirmatory PCR if it's positive. I see the question about mandatory post-arrival testing. As you know, Kauai had been trying to do mandatory 72-hour post-arrival testing since last summer, and multiple requests to the governor in multiple formats were denied. So that's why we're not doing it. Maui is opting to follow what the Big Island was doing, which is post-arrival testing at the time of arrival as opposed to 3 days later. And we opted not to go down that path because we're less convinced about the benefit of that. But obviously it's a trade-off. If you do testing immediately upon arrival of everybody, you get everybody tested, but you don't have as big an interval between the time of their pre-travel test and the time of the follow-up testing. Also a question of resources, and because the governor has not approved any mandatory testing that involves any cost to the traveler. The cost has to be fully borne by the county, and the county of Kauai is putting their testing resources into offering free community testing, not at the airport, but in the community.
Awesome. Thank you.
Thanks for that comment in chat, Jim.
No, yeah, thank you, Jim, and thanks, Janet, for providing your insight. And it's we've had this discussion many times within our circles, and hopefully with the vaccines, that there will be less of a negative impact to which whether or not Kauai or the state is who is right in implementing it. I think at this point we just want to protect our community. But like we discussed in the past couple weeks, how we're gonna go about doing this vaccine passport remains a very much a mystery. And Janet, I'm not sure what's going on the local levels, if you heard anything, but I know at a national level it's still pretty murky. But still waiting for guidance, at least from what I've been seeing.
I can preview what the county of Kauai is working on. It's still in the proposal and development phase, so it's not at all a done deal. But we're looking at a county-led initiative that would allow residents or frequent visitors prior to traveling to bring their ID and their vaccination card to a county site to be determined, where their vaccine card would be reviewed to make sure that they had completed their vaccinations and completed them at least 2 weeks ago, and that it matched their ID. And then that card would be validated with a stamp or with a county embossed seal, maybe on a photocopy of the card rather than on the card itself, because we don't want to deface the card itself. And then that validated paper document would exempt them from pre-travel testing and quarantine for inter-island travel only. So it wouldn't be something that arriving visitors could use, but it would be something that residents could use if they were making a trip to a neighbor island for business or work or to visit family, and would facilitate inter-island travel by residents. It could also be used by people who live elsewhere and come to Kauai frequently. But they would have to do it when they were here visiting, subject to the usual rules, and then could use it going forward. So we're hopeful that that would be, a benefit to our residents and also somewhat of an incentive to be vaccinated.
No, that's great. I obviously, it's there's a hope for unified effort nationally and internationally, but can appreciate what you and the mayor are doing to take care of your residents, to make it easier for them to travel and see family on the other islands, and to conduct business without having to pay for a test multiple times, and to incentivize. I think that's unfortunately what it's going to come down to get a lot of the people on the fence to choose to get vaccinated. So love to hear that effort. I know we have one follow-up question from Jim, whether the governor has ever explained for this post-arrival test other than day of travel. Jim, I haven't heard anything, but I don't know, Janet, if you have.
I can speak to that because he's had two concerns. So early on, what Kauai wanted was to have people subject to quarantine, and then when you tested at 72 hours, if that test was negative, then you could be released from quarantine. So the governor objected to adding any quarantine period on to safe travels. He wanted safe travels to be a clear, consistent, easily understood. If you have a pre-travel test, you're not subject to quarantine period. So he objected to the addition of quarantine. The other thing he didn't want to do was to burden travelers with a second test fee. So now what we're doing is not having a quarantine in that 3-day period. We're in safe travels, you're free from quarantine, but we would like you to test at 72 hours. So if that were to be mandated, it would have to be free, because he's concerned about the disincentive for visitors to come if they have to pay for 2 tests, especially if you're traveling in a family. That's an expense, that's a not insignificant expense, which is true. But those have been the two things. It's been the added expense to the traveler and the inconsistency of adding quarantine days.
Perfect. Ooh, question from Lee. There are now RT-PCR tests that can identify the main variants of concern. Obviously, Jana, I know you can't speak for all of DOH, but have you heard of DOH looking into utilizing this technology? And I apologize, this is the first I'm hearing it, so I'm not sure exactly what that technology, the specifics of it are. But if you've heard anything.
Yeah, I'm not aware of any of that, but I will keep my ears open. And if anybody who's in correspondence, we can ask Ed Desmond in terms of what the state lab is doing. It's also obviously a question for the private labs, since they're doing the vast majority of the testing in the state.
Perfect. Marguerite, maybe if you or Ethan have any thoughts, maybe we can share that with the group whenever you guys do present. Maybe a short blurb on this new technology that Lee mentioned just now.
I don't know a lot about it. I just thought that I think it's like a research development. I don't think it's been commercialized. So certainly somebody could do it, but it would be more of a develop your own primers and do the PCRs type of thing.
Got it.
Certainly doable, but I don't know about getting approval for diagnostic testing and all that stuff.
Like mass sterilization.
Yeah.
Okay. Well, more technology and faster and easier to identify, and it is obviously great. And Lee, thanks for that. I'll definitely take a look at that as well. Any final closing comments from our group before we close up for today? And hopefully we'll have a deep dive next week, and we can spend a little more time.
Thomas, it's Janet. I would say it's National Public Health Week. So if you know anybody else who's in public health, give them a distanced hug and a thank you for the last year.
Oh yes, no, thank you. I've been seeing all these emails and it totally slipped my mind. But yes, a National Public Health Week. So concur with Janet. If any public health or public health minded person that you know of who's been supporting any type of effort for the past year or the past years, just thank them, because public health often goes unnoticed and unappreciated, unfortunately, but it's probably the biggest thing that keeps us out of hot water. And we could do way more if we had more funding, but I'm preaching to the choir here. But yes, it's National Public Health Week. And if you go on Instagram and you follow any of Hawaii Pacific, Hawaii Public Health, or any of the other national public health organizations, there are lots of free materials or free resources that they're promoting. So definitely take advantage of it. I know if we were back in person at UH, we would have dog therapy sessions throughout the week, but hopefully we can do it next year. But thank you for raising awareness to that, Janet. That's definitely important. But thank you all for coming. Apologize that quality was not quite up to par that I would have liked. But hopefully once I get used to this whole father lifestyle, I'll be back up and running normal sooner than later. But thank you all. Have a great and safe weekend. I will be very jealous of all the sleep that you're getting, but I'm for all of you who are seasoned parents, I know you guys went through it, so you can if you have any pointers, please email them to me. I'm more than happy to read every single one. But have a safe weekend, everybody. We'll see you next week Thursday. Take care.